Thank you very much for inviting and allowing me to participate. And Rajul has nicely pointed out how we have to be circumspect and look at many more things than just IOP when we are diagnosing. Are the slides visible?
Yes.
So even when you want to look at the patient of glaucoma, you have to preferably keep a holistic approach in the medical management. What do you mean by holistic? Holistic means having a wider view at everything. As we all know very well, in glaucoma management, there are many challenges which are faced day to day. First is that there are barriers to the healthcare system in all countries, not only in the relatively third world country like ours, but even in the first world. And therefore, a large chunk of glaucoma patients remain undiagnosed. Glaucoma in early stages is difficult to diagnose, especially when the IOP is normal. So, just as Rajul pointed out, you have to be very careful in your examination of other factors. Once you have started the treatment, we all have experienced this in our day to day practice, is that a very large percentage of patients drop out from treatment. And in my opinion, also, and in opinion given by many specialists, the poor awareness of the disease is the major contributory factor. So, what are the considerations for having a smooth initiation of glaucoma treatment? There are three important points which we have to keep in mind. And if we take it carefully, keeping in mind these points, we can reduce the dropouts or failure in adherence and persistence. First is the choice of the therapeutic agent should have any good effectivity. So even from the early stages, it is important for us to have a good evaluation and decide the target pressure which we are going to treat, keeping in mind the age of the patients and the severity of the disease, and start early with an effective drug. Very important is the safety. The adverse reactions, not necessarily systemic adverse reactions, but local adverse reactions are very often responsible for patients dropping out. So you have to choose a drug which is well tolerated and accepted by the patient. And very important to keep convenience, because if you make the patients disturb the patient's daily life in a major way, they are not going to be able to keep up with your complicated schedule. So if you have a drug which is convenient, safe, as well as being very effective right from the beginning, the chances are that you will do well. As far as the IOP is concerned, it is not just a single thing. IOP is highly variable individually and it is dynamic. It changes throughout the day as well as over days. So you have to keep seeing the IOP at different times. And you have to see when you treat what is the change from baseline. And necessarily, baseline is also a range, and your treated IOP also is a range. You have to look at the 24-hour IOP fluctuations. In many cases, especially the ones who are having a normal tension glaucoma kind of appearance and in eyes which seem to be doing progressing despite treatment, and it is difficult to do at full 24 hours. So we are all generally doing a day diurnal or an office diurnal, and but in some cases you may need to do a little more investigation. You have to see the responder. If the patient is not responding to your treatment, just a minor change of around 10% or 15% from your baseline level should not be considered as a response to your treatment. You have to have a predetermined level beyond which, when you get pressure reduction, you are going to consider the patient as a responder to that treatment. And once he has responded, you have to see that the response is consistent. We have seen in many studies that the IOP response may be very good right in the beginning, but over a period of 1 month to 3 months, there is a kind of a drift, and the amount of IOP reduction is not so robust after that period. So you have to be careful when you look at these things. What to check when you are in a busy practice is very complicated, and you have to keep these points in mind. We don't know what is ideal and what is practical, has to be determined by each individual practice based on their practice profile and their systems. But you have to keep these baseline factors in mind, and therefore keep it in mind that just a single IOP recording is definitely a high risk of being misleading. So take more than one reading. Even if you are not doing a full 24 hours, it might be worth calling the patients once in the morning, once in the afternoon, once in the late evening. At least you get a gross picture. And if you start treating patients on a single IOP reading, you are likely to make mistakes in your target pressure calculations as well as your responder calculations. So it is important for you to have a range in mind. And when the entire IOP range cannot be tested, we have surrogates, but they are not always very good. So you can test, for IOP control to identify peak. There are studies which show that you can do a water drinking test to identify a peak, or sometimes do a supine IOP after making the patient lie down for half an hour. All these tests are there to identify peaks, but they are not as good as a diurnal fluctuation. So you have to choose a drug, if possible, which has a consistent effect for the 24-hour period, and that will help the patient's adherence as well as his control of the disease. The commonest cause for patients to withdraw from treatment is the adverse effects to the topical glaucoma treatment. Sometimes they are vision related, quality of life. Very important is what we sometimes fail to understand is that a dry eye is a big contributor for drop in quality of vision and could be the cause that patient is dissatisfied with his treatment and discontinues it. So it is very important the patient has a good quality of vision and that the drug is not contributing in any way. Only then it's going to be adherent. And it has shown, many studies have shown that a large number of patients, almost 46, that's almost half the patients, are withdrawing treatment because of common side effects. And therefore, side effect profile monitoring is very, very important besides just looking at the therapeutic effect of the drug. And this study has shown dropouts, and it seems that all drugs within the first 6 months, almost 30-40% seem to be discontinuing their therapy. However, the prostaglandin type of drugs are the best as far as persistence is concerned, and the alpha agonists, beta blockers, carbonic anhydrase, all of them seem to be discontinued pretty early. So reasons we can look into, but I think the main important reason people prefer prostaglandins is because of the convenient single day dose. But all is not hunky-dory and perfective as far as the prostaglandins. This hyperemia is a very, very important reason for people's dissatisfaction and discontinuation of the therapy. Almost 1/3 of patients are complaining of hyperemia and discontinuing therapy because of it. So looking at the red eye, as we see in our day-to-day practice, is there are variable grades to just a little pink eye to a little more than that. And as you can see on your right, a real horribly congested eye, which the patient cannot probably step out of his house with an eye which looks like that. So you have to keep in mind these points about how much red eye is being caused by the drug. And there are ways to mitigate the red eye too. One is to use lubricants. The second way, sometimes I prefer patients to put the drop when it is chilled by putting it in the refrigerator and putting it. That seems to reduce the red eye. But in some cases, it just doesn't work. There are other contributory factors which increase the red eye, and one of them is blepharitis and lid conditions. So we can treat those more effectively. Sometimes that helps. So keeping in mind that reducing or minimizing the red eye that the patient experiences is one very, very important step you are taking in making sure the patient continues his therapy. So the treatment provider has to keep in mind certain points. One is that the adverse events profile with or without good pressure control should be satisfactory. How much is the difficulty patient has with the medication schedule, and whether they have some physical disability of putting drops where they have to depend on other people, and arthritis and neurological diseases as well as poor vision are very important factors which contribute to patients' inability to administer the drops themselves. And in our country, cost, of course, is very important. If you have prescribed a medicine which is very effective, minimum side effects, and everything is good, but if it is expensive to the range that patient cannot afford it for a long time, I doubt he is going to continue. And one of the most important factors is disease awareness and counseling. So patients are need repeated feedbacks on the type of the disease they have, what they should expect over time. And I have a very simple thing which I tell all my glaucoma patients is that you have to keep in mind that this disease is with you for a lifetime. Your spouse, your children are not going to be with you for a lifetime, but glaucoma is going to be with you for a lifetime. So you have to keep on doing what is needed to take care of it. Otherwise, it will be detrimental to you. The patient's side also, good awareness is very important. But as people grow older, they tend to forget. And forgetfulness, though a very negligible point for us, is a very important point for the patient. And keeping patients reminded about when they need to put the drops, I think cell phones are the solution, and alarms put on cell phones seem to do the trick pretty well in most cases, which I have noticed. So coming back, we have to give effective therapy and with a very low incidence or minimize the incidence of side effects and adverse reactions and keep the patient's convenience in mind. Only then we are going to get success. So it is a balance between efficacy, safety and tolerability, and patient's acceptance of the disease. Keeping in mind all this, you see the quality of IOP control, the mean reduction from baseline, the percentage of the response, and whether it is maintaining in the long term. So once you have started the treatment and evaluated shortly, what happens over long term is also very important. And keeping in mind 24-hour fluctuations is a very important point, besides patient compliance and persistence. So ideal drug for treatment would be one which is effective, giving quick IOP control and better circadian control, IOP 24-hour fluctuations, a very high responder rate, and consistent long-term pressure reducing effect. The safety and tolerability, low adverse reaction incidence, and preferably free of preservatives or optimized preservatives, so low concentrations of BAK. With this, if it is able to give stability of visual fields and improve the microcirculation, that would fit the bill ideally. What besides medication for IOP control, lifetime changes, getting good sleep is very important in IOP control. The meditation has been shown to be beneficial in many studies. So having calming kind of a meditation is useful. Avoiding large quantity of water intake at one time, which is known to produce very high pressure fluctuations. The general health of the patient is important, controlling comorbidities like BP and diabetes. Besides, there is a great beneficial effect in IOP control with exercise, especially the aerobic exercise rather than the resistance exercise. What is the role of supplements and vitamins? We aren't very sure, but there are some studies showing beneficial effects with vitamin B3, but it is still early days. All the same, as we have learned in the last 7 to 8 months, keeping away from vitamin deficiencies is helpful for general health and immunity. So therefore, it is also going to help for controlling degenerative diseases like glaucoma. The comorbidities which often play a role in the deterioration of patients, very important is nocturnal hypotension. In patients who have moderate to severe glaucoma, I usually go and make a specific point to investigate the type of hypertension medicine they are taking and the timing. Especially if they are taking night doses, we have to consult with their cardiologists or physicians and try to convert it to a daytime dose. Also, in patients who have a tendency for low blood pressure or are showing progression despite a very good control, doing a 24-hour BP test and identifying whether they are dippers is very important. Sleep apnea seems to be getting more and more involved in all chronic diseases, so also in glaucoma. And there are studies coming out of a significant number of open angle patients who have sleep apnea as a contributory factor. In some cases, ischemic conditions may be playing a role. So small percentage of patients you need to keep in mind and do carotid and ophthalmic artery flow studies and see whether there is some contributory factor. Overall, I would say keeping the patient as a whole in mind, considering their lifestyle, age, comorbidities, and other limitations has to be given due importance when deciding the therapy for the patient.